A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a highly charged series of testimonies before Congress, U.S. Health Secretary Robert F. Kennedy Jr. faced intense scrutiny regarding his stance on vaccines and the Republican-led proposal to slash healthcare funding to extend tax cuts. These hearings marked Kennedy's first appearance before lawmakers since his confirmation in February and were intended to address Donald Trump's controversial budget proposal, which threatens significant cuts to health department funding, particularly impacting scientific research. During the House Appropriations Committee hearing, Democratic Congressman Mark Pocan of Wisconsin posed a critical question. If you had a child today, would you vaccinate that child for measles? Kennedy's response, which included a hesitant, probably for measles, was met with concern. He quickly added, "What I would say is my opinions about vaccines are irrelevant. I don't want to seem like I'm being evasive, but I don't think people should be taking advice, medical advice, from me." This statement drew attention to Kennedy's controversial history as a leader of one of the most influential anti-vaccine campaigns in the nation. Vaccines, particularly the measles vaccine, are widely recognized as one of public health's greatest achievements, credited with saving an estimated 90 million lives over the past 5 decades. However, the U.S. is currently experiencing its worst measles outbreak since 2000, with 3 fatalities reported in Texas, including 2 unvaccinated children. As the hearing progressed, Pocan pressed Kennedy on other vaccines, including chickenpox and polio, to which Kennedy continued to deflect, stating, "I don't want to be giving advice." The tension escalated during his afternoon testimony before the Senate Committee on Health, Education, Labor, and Pensions, where Democratic Senator Chris Murphy challenged Kennedy's reluctance to recommend the measles vaccine, expressing concern that it could be dangerous for public health. Kennedy's testimony comes at a tumultuous time for public health in America. Under his leadership, the health department has seen the elimination of approximately 20,000 jobs and significant cuts to the federal biomedical and behavioral research budget, including a staggering 31% reduction in cancer research funding. The proposed budget cuts from the Trump administration threaten to reduce the health department's funding by tens of billions, particularly impacting the National Institutes of Health, NIH. The budget proposal also includes controversial measures such as adding work requirements to Medicaid and eliminating federal subsidies for individual insurance under the Affordable Care Act, ACA, which could leave an estimated 13.7 million Americans uninsured. Critics, including some Republicans, have voiced concerns over the morality and political implications of these cuts, with Missouri Senator Josh Hawley describing them as morally wrong and politically suicidal. Advocacy groups have mobilized against the proposed cuts, arguing that the work requirements are designed to disenfranchise vulnerable populations from accessing necessary health care. Julie Nixon, Director of Federal Relations at the American Cancer Society Cancer Action Network, stated, "These work requirements and reporting requirements are designed to kick people off Medicaid, and that's what they'll do." Despite the significant cuts to public health funding, Kennedy has reinstated certain programs, which Democrats argue appear politically motivated. He announced the reinstatement of 2 branches of the National Institute for Occupational Health and Safety, NIOSH, and the World Trade Center Health Program, which provides health care for victims of the September 11th attacks and monitors health risks for miners and firefighters. Kennedy claimed to have reinstated 328 employees at NIOSH, but the broader implications of his reorganization efforts remain unclear. Kennedy's testimony was interrupted by protesters during a Senate committee hearing, who chanted, "RFK kills people with hate." This disruption highlighted the contentious atmosphere surrounding his leadership and the ongoing debate over vaccines and public health policy in the U.S. As the hearings concluded, Kennedy faced mounting pressure to clarify his stance on vaccines and the future of public health funding. Critics argue that his reluctance to provide clear guidance on vaccines undermines the role of the health department and poses risks to public health at a time when trust in vaccines is crucial. The political landscape surrounding healthcare remains fraught with tension as the Trump administration pushes forward with its budget proposals, leaving many Americans to wonder how these changes will impact their access to vital healthcare services. That's all for this story. We upload videos every day covering many different subjects, So hit that subscribe button to stay informed. Thanks for watching.